Hello, I'm Tony Young, president of Rise San Diego. It's a great opportunity today to speak to you all and hear a really good discussion on how COVID-19 impacts our public safety and public justice system. Uh, Over the last couple of weeks, a number of weeks, we've talked about this issue, how COVID has impacted the urban community. And today, it's just a continuation of that entire discussion. Just so you know a little bit about Rise San Diego, we focus on urban leadership. We partner with the University of San Diego and many community organizations around San Diego to really try to culture and support emerging leaders in the urban community that either live or also serve in the community. We also do support for nonprofit organizations. We do trainings every week, and it's easy to get online and find us, and we will help you if you have a nonprofit to be supported, and we got great trainings for you. And thirdly, this is the issue that we're going to discuss today, and it's under our civic engagement pillar that we do every. That's part of our what we are at Rise is try to have these types of conversations. So we really appreciate you being a part of this, and we have a great team here to talk about public safety. We have Tonya Benjamin, who is a lieutenant in the sheriff's department, and she's done work all over she has a lot of experience and has done a lot of work within the sheriff department. Dr. Roxanne Kymanni, one of our lead professors, who is an expert on issues of leadership and group dynamics. Dr. Carlos Nelson is another Rise faculty member, but also is a psychologist that works with juveniles with the County of San Diego. And Laila, Aziz, who is a fiery, dynamic advocate for inmate rights and reentry, the rights for people who are in the reentry process of their lives. And finally, Dr. Green is our moderator. He's amazing, and he'll take over from here. Dr. Green?
Thank you very much, Tony Young. I really appreciate the opportunity to speak with you again tonight. And this whole notion of public safety in the context of COVID-19 is really important in terms of our community, because what we now are facing are some very difficult decisions. On one hand, we have the propensity to have exposure to some who are incarcerated, especially in our adult facilities, and the impact of that. But on the other hand, we have issues of public safety. We have the intersection of issues of mass incarceration that are now showing up, and the potential of mass infection because of the difficulties that we have around this. We also have the issue of juvenile justice. How do we make the decision about who's released? How do we make the decision about the impact on families? And how do we blend all that together to make decisions that are best for our communities? Today we have a wonderful panel, and I would like each of them to say hello to you. First, we'll hear from Laila Aziz from Pillars of the Community. And I'm going to ask you, just in 1 minute, just try to give us some sense of what is the real issue here around public safety and COVID-19.
Thank you so much. My name is Laila Aziz. I'm with Pillars of the Community. We work to decriminalize our community. We believe that our nation, including our county and the state of California, has relied on the criminal justice system to hide the imperfections instead of ensuring that everyone in our community is safe, everyone in our community feels loved, and they feel wanted. So that's one of our main things. And COVID, with mass incarceration or mass elimination, has now put a death sentence on us over incarcerating so many individuals. Thank you.
Thank you very much for that. And then now we're going to hear from Lieutenant Tonya Benjamin from the San Diego County Sheriff's Office.
Hello, everyone. I'm Tonya Benjamin. I've been with the Sheriff's Department for 20 years. I'm a lieutenant. I'm currently assigned to the Las Colinas Detention and Reentry Facility. Out of the 7 county jails I've worked 5 on the floor, first line, 2 of the other ones, I've worked the classification unit. But I would say the most concern with public safety is, of course, the jail population, because of the closer living quarters and housings that we have available. Some jails are better than others. However, on the other hand, also the public safety enforcement out on the streets, which also plays a part. The jail and the street enforcement go hand in hand. We must work together to ensure the safety of our community is at its best. So that's the way I see things.
Okay, thank you very much, Lieutenant Benjamin. And then finally, we're going to hear from Dr. Carlos Nelson from the County of San Diego's Juvenile Forensic Services. Dr. Nelson.
Hi, good evening. So I'm Dr. Nelson, and I work with the County of San Diego Health and Human Services Agency with Juvenile Forensic Services. And we provide the mental health services to the youth who are in custody, as well as to the youth who have left custody or back out in the community. And I think, you know, what I'd like to say as the #1 issue would be how to have as many of the youth out of custody as possible in a way that maintains community safety, and in a way that we're still able to provide services to them in a way that can be helpful. Knowing that some youth, you know, we're not really in a position to release, but I think we're doing the best we can to have as many youth in the community receiving services rather than in custody.
Okay, thank you very much. And so what you're hearing is a range of issues that are already present. One of which is then, how do we deal with these issues of mass incarceration and their impact and the decisions that we need to make around that? How do we deal with the close quarters of a prison population and its impact in terms of the virus? And then in terms of the youth and the vulnerable who are in detention centers, how do we also assure their safety, as well as a host of other issues? Those of you who are new to a RISE webinar, let's give you a few ideas of the sort of housekeeping of how we approach this process. So for the first part, most of you already know this, is that if you can stay on mute, what we're going to do is we have both the question and answer box as well as the chat box. If there are ways that you would like to ask questions of the panel, feel free any place in this process to begin to put those questions in or comments in the chat box, and we will be attending to that as we go along this process. We will not be using the hand feature, nor will we be using the audio feature for you. Sorry about that. But this is our way to make sure that we really give a lot more focus to the time of the panelists to have their opportunities to speak. And we also want you to know that this webinar is recorded, and after the fact, if there's a way that you would like to hear about this or other things that we've done in terms of these webinars, feel free to check that out at RISE San Diego. We also want to make sure that you're engaged in this process, and we want to have a sense from you of what the issues are that brought you to this webinar. So our way of doing that is to have a poll. So we're going to pull this poll up right now, and these are the questions, or the question. In terms of your perceptions of the public safety needs in urban San Diego, which of the following do you believe are most important to address? The first one is related to law enforcement. The second one in terms of public safety agencies. The next one is in terms of housing and food. The other one is in terms of jail and prison facility leadership. And the other one is reducing jail and prison detention facility populations. So read through those, and we'll give you about a minute to begin to choose the one that you believe is the most important question for us to begin to address. Yes, and I know the panelists want to vote. I'm sorry, you don't get to vote. You get to answer the questions. Or you can go through the back door come in a different way, and then that way you get to vote. Okay, another 30 seconds, everyone. Okay, we're going to close the poll and we're going to see what your results are. Okay, there is a real skew in this group. It is really about reducing jail, prison, and detention facility populations by sending people who do not pose a threat to public safety home, and limiting the number of newly incarcerated people coming into the facility. And second to that is prison and jail detention facility leadership must strike a balance between maintaining order and safety while providing the best possible care to and upholding the basic human rights of people. Well, we have a very clear direction that those who are present want to hear. So it seems like Laila, Aziz, you're on because it sounds like the people here want to hear from you in terms of really what the issues are. So you gave us the first minute of that, but there are other aspects of this which I will ask Lieutenant Tonya Benjamin to speak to as well. So Laila, Aziz, can you lay out the issues for us, please?
Well, from our perspective and our point of view, and from a great deal of the community members that we do work with day to day, the paradigm shift needs to occur that prisons and jails do not work as a whole. And a lot of people see that. And people can do that where they can walk and chew gum at the same time by still saying that people who are dangerous people can still be held accountable. In California, I believe we have 33 prisons. We probably could get that done with 2. And that's what people are talking about. And they're talking about the budget of $80,000 per prisoner, $300,000 for the Department of the DJJ, Division of, as we know as California Youth Authority. In my time, we're looking at mental health and how the jails have become the #1 mental health provider, and how people are dying at alarming rates in our jails. And I don't come here as I am an activist and I am an organizer, but I come here after 19 years of experience, training nationally, working with both youth and adults re-entering into society. I have been on the other side of this. I have tried to play fair with the district attorney, the sheriff, and a lot of other people in trying to make this happen as holistically as we can. And I believed at one point, many years ago, in the system. And it became apparent at one point that the system is not broken. The system is functioning exactly as it was intended to do. And a lot of people are starting to see this. We're starting to see the remnants of a system that was built after slavery and why it was built. And there's horror stories that anyone who works in the jail can tell you. There are horror stories that victims, me being one of them, can tell you that has happened to us, but that's not the majority of people that we're locking up. And we're saying that these people's lives matter, your sons matter, your daughters matter, your grandchildren matter. And what we need to do is get to those underlying conditions. They want to tell us Black folks are dying because we have diabetes and asthma and all of these other things. People are in jail because of underlying conditions, such as mental health, substance abuse, and poverty. And let's start looking at those root causes and stop hiding away our country's failures on giving people a good job, on giving communities who don't have a lot of money a great education, and demand that those things happen. We welcome everyone in our community. Right now, and I'll say that again, public safety going on in our community is being done by people that other people who don't understand us would call gang members. Those are the people feeding people. Those are the people doing delivery drop-offs to seniors. But because of this label, and we can talk about that also, in how if you go to jail right now with a gang enhancement before you're even convicted, your bail is $100,000 for a misdemeanor. And we are confronting those systemic racist issues day to day, and we're demanding it stops. And I'm noticing that our community and the world and the nation is also seeing this. It's a new day. But right now we still have some issues because some of the powers that be, like our sheriff, keeps arresting people for non-violent crimes and putting them in jail. I believe there was a gentleman they found, he was arrested how many times in the Union Tribune? 13 since the pandemic. This is a man who needs mental health treatment. And then we're gonna have another death. And I work with families through participatory defense who have had numerous family members who have died in the jails. And I think we can stop this. I think we can together look at a better world for all of our people. Thank you.
Thank you very much, Ms. Aziz, because what you've really laid out is that there are not only the immediate issues in terms of COVID, but you're talking about a paradigm shift that we need to consider. But you also called out the sheriff's office in this. And so I'm going to turn to Lieutenant Benjamin in a second, but I want to pose one more question to you. One of the questions that we raised in this poll is the balance in terms of issues of public safety. Now, granted, some mass incarceration is a function of crimes that really do not merit the kind of incarceration and the kinds of sentencing. There's no argument about that. But you also pointed out that the jails have been this place where mental health issues have been, let us say, warehoused as well. So how do we balance those needs of the community versus the kinds of issues that you're talking about, systemic racism and mass incarceration?
Well, there has to be, and I'm going to say, Ms. Tonya has never denied me entrance in allowing people to vote, as some of the sheriffs have, which is, I believe they took away their federal rights. I've never had any bad experiences with the panelists on here. So when I'm speaking harsh. I got names, and she's not one of them. But the issues that we do need to do is a reinvestment. We need, right now it costs $52,500 to each year that the sheriff gets for detentions based on their jail population. So I can tell you a lot of money with just closing down one of those facilities. Let's start with George Bailey, how much money that we would save. Or let's start with Facility A, or let's start with East Mesa. But I know East Mesa is a lower level. So those are nonviolent people that a lot of them are serving time, their county time. Let's look at those aspects, and let's look at putting that into mental health, true mental health, with mental health specialists.
Okay.
And that's a fight, because that's taking their money.
Okay, I do want to come back on the public safety part, because that's the part you didn't address, but we'll come back to that later. And I'm going to turn to Lieutenant Benjamin right now. Okay, Lieutenant Benjamin, there's an issue that's being raised here by Ms. Aziz. The issue that she is raising is that there are issues of incarceration, there are repetitive jailings of people, and sometimes this is about mental health, but we have to balance this against public safety. What do you have to say about this?
Well, the issue of public safety and mental health, that's been long time existing. I mean, even before I even came along. I've been literally in jail for 20 years. So I've been there too. I've been in jail, literally. I say, as far as the sheriff's department, we recognize that, we're governed by, the governor and other federal rules and everything. So we've been making those positive changes towards reentry. I mean, I think that's it. That's our new motto right there, is reentry, to try to prevent the recidivism, to lower the recidivism. We're doing everything we can as far as trying to get people to.
Can I just ask you to pause there for a second? So I know that your policies are about reducing recidivism, but the issue seems to be that some places in the department, the focus is really on the dollars and cents that continue to perpetuate the kinds of issues that Ms. Aziz is speaking to. What do you have to say about that?
Well, I mean, that's pretty much out of my control. I know money, budgets is a big issue within the sheriff's department. But as far as the public safety, I think we fare very well. As far as like Las Colinas, we went from a 900 population down to a 500 population to try to, get those out for their safety who, have lesser nonviolent crimes, more misdemeanor crimes. The law enforcement side has, not been arresting those people to bring them back in jail. We've made an emergency bail schedule. So those who usually who would get arrested, who would usually have bail, no longer have bail. So they're basically booked and released back out into the streets. So I think we've done pretty good for something that just came along, blew up unexpectedly. And I mean, I'm actually proud of the job we've done as far as with our community. We have been keeping our community in mind about their safety, about the public safety. We're trying to get people out back to their families, keep people in their homes off the streets to stop the spread. The mental health, we've had so many mental health clinicians, psychologists, doctors. The sheriff has been hiring those people to address mental health issues. We can barely get people out to mental health facilities because those mental health facilities out in the county and in the state of California, they're locked. So within the jail, we have become pretty much a mental health facility ourselves. So we've had to make new housings and hire these professionals to try to get these people who have mental issues the help that they need. So we're doing the best we can with what we have. Okay, I really believe that.
I want to work with that because it's the job of Dr. Nelson to be working around these mental health issues, along with working with youth who are incarcerated. So Dr. Nelson, can you balance out this picture for us, please?
Yeah, I don't know if I can. I don't know if I can balance it out. I feel like I might end up on one side or the other. But what I will say is that when I started in the position I'm in now, about 12 years ago, we had about 800 youth in custody, and today we had 197. And when I was hired for this job, what I was told was to do whatever it takes to make sure these kids don't come back into custody. And I know that the county and on my little part of it especially is spending a tremendous amount of money on trying to provide the resources to these youth and the families that, you know, whatever we can do to help them out. And since the COVID thing has come along, I would, you know, one of the fortunate things that has happened is, you know, freeways are less crowded, things like that. There's a lot of meetings we don't have to go to. But another thing that's happened that's a fortunate thing is that the juvenile facilities don't take in misdemeanor cases anymore. So if a juvenile is arrested, there's some exceptions, but if a juvenile is arrested and they're brought into the facility, we don't take them unless they have a felony charge. Now, police departments could up the charge just to get them in, but the policy is no, we don't take any more misdemeanor cases. And we've made a huge effort to release as many people as possible to basically keep them out of harm's way. And you know, the youth facilities are different than the county jails, but I would say that sometimes releasing the youth, you know, we've had some bad outcomes. You know, it doesn't always go the way that we would hope it to go, and unfortunately, we can't always predict that. But we do make a good effort, and I'm proud of what we are doing. Also, I think that we're doing you know, really a good job as best as we possibly can to keep our youth safe and to provide them with you know, their days are full of services. And we've had no COVID cases in any of the facilities except for 2 kids who were brought in, imported from other facilities because we thought they were not safe where they were at, so we brought them here. But so far we're at 0 except for those 2 kids.
So Ms. Aziz, then both Lieutenant Benjamin and Dr. Nelson are speaking to a different aspect of that. Ms. Benjamin is speaking to, we're trying to deal with the mental health issues because there's no place to place them. We are reducing the number of people that are incarcerated. And Dr. Nelson speaking to, we had 800 people in that were young people incarcerated. And now we have fewer than 200. So it seems like the exact issues that you were raising that they're trying to address. But you're saying that there's something else that we need to consider here.
Well, I think that's the agreement we're almost coming to. Okay. Is a pandemic demonstrated we don't need that many people locked up. Let's start there. Okay. And that's a reinvestment in our people. So I see the numbers. So I know they have definitely reduced the population. I do see certain areas that, and we're talking about gang enhancements, we're talking about the way, and this doesn't have to do with the sheriff unless they were the arresting officer, In some areas outside the city, the sheriffs are doing the arrest, but the police department and those sheriffs doing the arrest and the district attorney who are allowing stacking of charges and trumped up charges. And it starts with the sheriff or the police officer with probable cause to stack those charges. And I'm seeing a lot of those that are affecting people of color and poor people because of the way they do business. And this is not new to the pandemic. They've always done business like that. You have a kid that has candy and they snatch their arm, they give them robbery for petty theft. That's just what they do to our kids. It's nothing new. But this is going to make you stay because, as the gentleman said, Dr. Carlos Nelson, that the felonies and trumped up charges, which we always deal with, so it's not new, but we stay in jail now or stay in juvenile hall, and that becomes a death sentence. So we're using this time to make people pay attention to what's been going on forever.
So you're saying that there is already the historical disproportionate impact on our communities. That's what you're saying. But Dr. Nelson, this reduction hasn't just been a function of COVID. I would imagine that you've been working on this reduction for quite some time.
I mean, this has been the goal for quite some time, to reduce the number of youth who are in custody, to provide them the services, prior to them ever coming into custody, to really, to spend the money on the front end of as youth starts getting involved in the juvenile justice system. Now, I agree. I see a lot of youth, not as much now, but 6 months ago, that they come in on, I don't want to say they're trumped up charges, but she's right. Someone goes into, they steal something small, $30 headphones is an example I have from one kid, and he gets felony robbery, and that's unjust. And there are a number of forces in the community that are making an effort to put an end to that. And but these changes have been taking place for quite a while now. Well, not maybe at least 10 years, right? And I know they're going to continue in that direction. And it's true, COVID has turned up the volume on our need to not have people locked up. But again, I have to say, there have been bad outcomes from some people leaving custody.
Well, thank you very much for speaking to that. Lieutenant Benjamin, there seems to be a recognition that the efforts have been made, but it sounds like there's a request that even more be done. What do you have to say about that?
Well, I mean, I've been also when I was a sergeant, and I've been a part of a pretrial unit where we try to get these people out on home detention, where they wear, GPS bracelets instead of keeping them in jail for certain things. Let them go to school, let them work. So we also have separate units that are also, working with the district attorney, the courts, to allow these people to go out and be home on home detention versus being in jail. As far as the trumped up charges, I really can't speak on that. Someone from the courts would have to speak on that. But as far as trying to keep people out of jail and not trying to be so disproportionate, I mean, we have other units that have been trying to work on this as well.
Okay, so
I mean, the population in jail is already skewed. I mean,
yes.
It's mostly Hispanics, whites, and blacks. I don't know why Hispanics are coming to jail. I don't know, but that's who's coming to jail.
Okay.
I don't know.
There will be some issues around disproportionality and the sort of kinds of issues in terms of historical racial patterns. Some would say outright racism and the kind of structural elements of that. And before I turn things over to Dr. Kymanni to do some follow-up, again, Laila, Aziz, you probably have some thoughts on this before we transition to Dr. Kymanni, because you're standing there and I can say, I got something to say about this.
Yes, in San Diego, California, if you look at the population by race, there are more Hispanics in jail. Black people are always more overrepresented in our jails, period. always have been, based on our population for the county. And that's what we need to look at when we look at racial profiling and other things. We're never going to be 40% of the jail population. We don't have the numbers. If we did, we would. But so we need to start there. When we did, and we challenged even the bail and the pretrial and how they do the pretrial assessments and different things, and look at public safety and things of that nature. When we looked at, and we bailed out Black and brown women on Mother's Day, and we didn't look at the charges. We looked at how we treated them when we bailed them out. We didn't do a risk assessment. We put ourselves at risk so we can be in these people's lives daily or even weekly. 100% court show up and 0 public safety issues. That's a paradigm people don't want to get around because it's not as expensive and it doesn't line people's pockets like how things are done right now.
Okay, so you have the data to support what you're saying. Okay, Dr. Kymanni.
Yes, I'm curious that each of you have mentioned something around the need to balance the needs of the community. And there's been questions by the audience in reference to who is we and who are the people. And so I'm curious if each of you can explain how you fit into the we and the people based on your role as well as being a part of the community. And I'd like to start with Dr. Nelson.
Yeah, it's a tough question. I know that looking at me, I'm about as white as you can possibly be. It look like I'm part of the dominant culture. My name is Carlos. I've got, my background, and I can get into all of that. I live in a place that's, but I don't know how to say it, but anybody who knows me knows the work that I do with the youth and the communities that I work with and in. And I feel proud to say we. It's not me, and it's not me trying to help them or me trying to empower them. It's me standing with them. Both while they're in custody and when they leave custody, and if they come back again, and all of the above.
Okay, so my follow-up question for you then, balancing the notion of we in the role that you take on within the juvenile system, as well as being somebody of the people. How do you balance the complexity of being a civilian out there as Carlos and living in COVID, and then also being Dr. Nelson in the work that you're doing within the community?
It's very easy for me to balance it because I hate to sound so trite, but we are one. And the community is in my heart. My heart is in the community, and it's the community is broader than just Southeast or just City Heights, and I don't know how else to answer the question other than say that this is something that we all should be working on together. Not just me as a psychologist in the system. All of us panelists should be all on the same side. Now I know we take up different roles, but the youth that I work with should be on this panel right now also, and they should be part of the audience, and other people who have been incarcerated, people who are not. We're all in the same. We are all part of the problem, and we are all part of the solution.
Thank you. I come to you, Lieutenant Benjamin. How do you consider yourself as part of the we as well as part of the community, and how do we balance both of those?
Okay, when I was saying we, I was specifically speaking for the San Diego Sheriff's Department and just the community, knowing the Sheriff's Department's goals and their visions with the community to be the safest urban county in the nation. That's what I was speaking of when I said we. I'm for everybody. I'm from Podunk, Cope, South Carolina, where the racism is real, where the Confederate flag flew on Columbia, South Carolina State House. So I'm not racist. I'm for everybody. I want equality and justice for everybody. fairness. I mean, I know to be honest, nothing is fair. Nothing is fair. It's not ever going to be fair. But we just have to find a way together to work together and to come to that end goal, or at least some type of just some type of agreement to where we can all just try to make this work. We can't make everybody happy. Everybody's never going to be happy, but I would like we, the sheriffs and the community and everybody, no matter what race, red, black, blue, brown, green, just for everybody to work together and just try to make San Diego the best we can be.
So how do you balance out the complexity of you as a civilian and you as sheriff? I know that there are places that those cross and it's very ingrained in your identity, but when you try to look at those separately, how do you navigate the complexity of all of those things combined?
Yeah, when I'm off and I take my uniform off and I sit my gun down, I'm a citizen. I mean, that's how I balance that. When I go out into Walmart, I'm Joe Smo citizen. That's it. I don't look for things or look for people or looking at people with a raised eyebrow. That's just not what I do. I'm just a normal person who tries to get along with everyone and be kind to everyone, and that's how I balance it. That's it. I don't take work home with me. I don't take it out in the community with me. After I'm done with work, I'm done with work. That's it.
Thank you. Ms. Aziz, how would you offer an answer to the question?
Come here, you guys, really quick. Today we're gonna barbecue, but we're waiting for the sun to come down because of Ramadan. But these two young men, the twins, Juvenile Hall, were tracked to go to prison. Their father was murdered in our community, picked up left and right. And then who was we? What happened with we? We was our community. We said that the criminal justice system is not going to raise our children. These trumped up charges of a terrorist threat with no witnesses, that you gave them felonies to destroy their lives, you're not going to be able to do that. And we're going to make sure we exhibit public safety. We're going to make sure we protect our community. That's the we. So it's everyone in Southeastern San Diego who extended their hands to these young men. Everyone who made a family for these young men. Everyone who saw them through Mesa College. Now you guys are at UC Riverside and on their way to law school is a part of that we. And I'm a very small part of that huge we in our community, but these are our community children. And I'm radical. Like me and the sister here, we can be friends, we can kick it, we can have drinks, but we can't talk politics because I am here to eradicate the criminal injustice system, period. And I don't and this is not to the people that work for it, because Nancy Clever with this gentleman, she is one of my mentors in this work and has always been. The counselors, I love them in Juvenile Hall. They always tend to see what we need with the young people. But the fact of the matter is our criminal justice system needs to be eradicated and something else built for public safety. Because we would have been in the pits of hell right now if it was up to them. So that's the we, our community.
Thank you. I'm curious, I'm going to take it into the conversation around the differences between how the youth in incarceration and the adults in incarceration. What are the differences that are there? And speaking to Dr. Nelson's of the very significant change in numbers of youth that are incarcerated within this county, what are we noticing that is happening within that community versus what needs to be happening in the adult incarceration facilities? Where is the disconnect? What is happening that the community can support, that the community can activate on and be in support of trying to lower those rates?
Lower the rates of people in custody?
Correct. I was referring to how you've spoken about 800 youth going down significantly and working and doing everything that you possibly can for them to not come back. How is that different than what is happening for what Ms. Aziz spoke to about somebody being arrested 13 times during the pandemic and that being something that seems to be chronic? What are the ways that needs to change, and how can the community be in support of it?
Well, I kind of want to say, and I guess I'm going to say it and then take it back, but I want to say that the community is in support of it, especially in the community that Laila's talking about. I wish there were ways for the various parts of our San Diego community to come together and see us more as one, while also appreciating the differences that exist in each of the communities. I don't want to, you know, money helps, of course, but it's not the answer to everything. I don't really sort of know what the answer is. I don't have a solution. I try to be part of a solution. I think that you know, I want to say that some of the kids who we do have in custody, the ones who do come back over and over again, they tell me in private that, and I believe them, that it's safer for them to be in custody, that there are times that they get 3 meals a day, they have a bed, they have better health care. Now, and I think that that's true, but that also speaks to the injustice of the larger society, and that, you know, from my point of view, those services should be provided. A kid shouldn't have to say, I'd rather be in jail because I feel safer there, or because I'm getting health care there, or something along those lines. There are tremendous resources being offered to kids who come into custody or who get involved in the juvenile justice system. And I just hope that they are getting those same resources. The kids who don't come into the juvenile justice system get those same resources. And but I don't know, because I work, my interest in my work is with the repeat offenders, the kids who come in over and over and over again, the ones that I think the system has given up on. That's where my heart lies.
Well, can I step in here for a second? So we're getting a real sharp push in the chat, and maybe you're seeing this, is that Dr. Nelson, how can you actually represent the we? And Lieutenant Benjamin, it's saying that you seem to be, by definition, perpetuating the injustice towards people of color, that your personal perspective is very different from the reality of the role that you have. I would like both of you to address this, because this is coming through very powerfully among the people that are part of the viewing group right now.
So I don't want to try to speak for the people who I work with. First of all, my larger interest is in them having their own voice, which is why I say things like, how come none of these kids are on this panel right now? But that's my interest, and where and when they don't feel able to speak, I'm in a unique position in that I look like I'm part of the dominant society, and it's very easy for me to walk in those circles. And the youth that I work on can expect and can count on me to go to the city council meetings, or to the chief probation officer. They can count on me to speak up on their behalf. And sometimes I feel like I'm sneaking in there. I'm sort of subversive in a way, and I create some enemies along the way. But beyond that, I think my personal experience is like, yeah, I'm Dr. Nelson. I'm this old white guy who's part of the system now. I wasn't always that person. I grew up with a father in prison. I grew up with a father in San Quentin. I grew up with a father who was homeless and died on the streets. I grew up on food stamps and Medi-Cal, and thank God for the unions. And I grew up as a gay kid. I know what it's like to be discriminated against because of who I am, but I'm, I don't know if I want to say I'm blessed, because I can sneak my way into the boardrooms. But people, there are people in the community who count on me to do that, and they specifically come to me because I look the way that I look, and they know I'm going to speak up for them.
Lieutenant Benjamin, you're still on.
Yeah, well, first of all, politics, that's not my thing anyway.
No,
so
I was not about politics. It's about you perpetuating injustice. You're part of the system that does that. Because Ms. Aziz,
yeah, because
have to say about this in a minute.
Yeah, it's just about separation and balance for me. I'm governed. I swore in an oath to do the job that I chose to do. of what I have a passion for. I mean, that's what I chose to do. So I'm governed to do certain things as I swore in and said I would do. However, when I'm not within that capacity, I am a normal person at home. I don't eat, breathe, and sleep law enforcement. I do not. So I've been discriminated against in my own organization, you know? So either you lay down and die, or you take the high road and you rise above. And that's what I chose to do. And just like others, I'm a Black woman. So, you know, there you go. I have 2 strikes against me already. I'm Black and I'm a female in a white sheriff's department. Okay. I am raising a little Black boy and a little Black girl, 6-year-old twins. So I have the same concerns about racism and getting into the system as everybody else do, but I can't let that consume me. So I just find a way to separate and balance everything. That's it. It's not trying to play both sides of the fence, but what's right is right, what's wrong is wrong. And if I see something that's wrong, I will address it. Or if I see something that's right, I will praise it. So it's complicated and I can't really explain it, but that's what I do to survive. That's how I live.
Okay, so I'm going to turn this over to Ms. Aziz. Both of your fellow panelists are trying to speak to a much more complex picture of who they are as a part of the system that you're trying to address and dismantle. And by bringing in your children, you're saying that they would have been a victim of a system that would have had them go into the prison pipeline as opposed to on the way to law school. So can you help us address why you're so passionate about what needs to be done to dismantle this?
Yes, and these are not my biological children. These are the community children, but I also have identical twins who are 11. And it's my job and it's their job to prevent my children from ever going into the prison pipeline and building that. And I believe in morals, and I believe that we're able, let me just stop here. People like the panelists are not the people that put in systemic injustices. The sheriff, and I'm talking about the head honcho, needs to be held accountable. His policies are racist, and he can't run from that. He has commanders under him. And it looks like this sister right here might end up being one based on how things go. These are the people that I fight in order for us to be able to get access. And you have a whole argument from people of color and progressive whites on them working within the system in order to kind of reform the system. And if I believe that the system could be reformed, we could probably have a conversation. But I do understand where they're coming from. I do understand how they feel about things. One of my cousin, I'm not gonna say where she is, but it's in one of those Confederate states with immigration, caught a man driving who was a undocumented person. And I was like, oh gosh, she got him deported. I said, what happened? She goes, I told him to get off the road. I'm not doing all that paperwork. There's a difference on how certain people approach their jobs and looking at that. But at the end of the day, if it's a plantation, you can't sugarcoat the plantation. It's still slavery. And you might be an overseer, and there were some nice overseers, but that's what's happening. And I'm not saying that to personally discredit anybody's work. I'm saying it's a systemic issue. It's not personal. And we're changing laws, and we're building power, and we're finally being heard, all of the people that have been fighting for this for 2 decades in order to dismantle slavery, legalized by the 13th Amendment.
Tony Young, it looks like you're about to say something up in here. So what do you have to say?
No, I'm not going to say anything. I want to hear what these folks have to say because I'm enthralled.
Okay, because what just came in, Roxanne, you want to speak to the question that just came in about spaces? Yeah, speak to that.
So a question from the audience: what role, if any, should community spaces of sacred trust, such as religious or educational, etc., play in not only in brokering safe space for dialogue, but fiscally empowering the work in these times? It's a good question.
I can say this because I've been at that table before, and there are people that can do that. At Pillars of the Community, we did community agreements with the community, and law enforcement is not allowed in our space. And we ask that law enforcement not come into our space. And I know that that upsets a lot of people, but that's what the community wanted, to feel safe. There are people that can sit at a table with law enforcement and can sit at a table with policymakers and look at how they can make slavery a little bit less painful. And I'm okay with them doing that. I'm not going to participate. But so that's a conversation that I think reformists need to have. But I believe the system has been so broken that there's no more reform needed. And every now and then, if we lead towards any reform, it has an abolitionist endgame to it, if that makes sense.
Dr. Nelson.
I'm struggling with how I can agree with Laila, because I do, but I also, I live in this other world, and I'm part of a community that with these youth who think they would never ever be buddies with a police officer, and but given the opportunity to, they pair up. And I live in this community where there's police officers who look at these kids as thugs and criminals, but given the opportunity to go to boxing lessons with them or to go to a class with them, they start viewing them as they start seeing them as kids. And I think that juvenile hall, I almost hate to say this, but you know, and maybe this is a way that we totally deconstruct the system, but juvenile hall really should be a sacred place where healing can take place. Now, I know it's not always like that, and I know that, you know, that doesn't work. Yet at the same time, I know that I'm there. There's people like me who are there. There's community-based organizations who are there. There are religious organizations who are there. There's school teachers who are so passionate about working with this particular group of people that that their day is really full. It's difficult for me to get in there sometimes. So I don't know, that was a rant, sorry.
There's so much that is going on right now. The chat is getting hot. We only have 5 minutes left. We do want you to respond to this, Lieutenant Benjamin, but Dr. Kymanni is going to ask you to do the call to action. So Dr. Kymanni.
Yeah, so this is, you know, not just for the audience, but as all of us are part of this community in whatever shape or form we take through the roles that we play, through the identities that we hold. You know, the question that I have for you is, who are you willing to be right now in this community as what we need it to be? Who are you willing to be? How are you willing to step up in a way that is safe, holding people accountable, and activating those around you for the public good?
Yeah, Lieutenant Benjamin, you're on first, yes. Well, yeah, you have to take yourself off mute. Okay. Go ahead.
Who I'm willing to be?
Yes.
I can be no one but myself. I cannot pretend, act, make myself be anyone else. If I think it's a good cause, whatever the community action plan is, then, you know, I'm there for anything that's for good. I'm open. I'm not closed off. So I'll be myself, and anything that's for the good, for the community, for the kids.
Okay, but as this representative from law enforcement, what is then that one thing that you want to say that, okay, this is the call to action? One thing.
Okay. Well, the call to action is that the Sheriff's Department, I really believe the law enforcement, we really care about our communities. And we want to help. And we want to be part of our communities, and we want that trust and that transparency.
Okay.
So
it's about transparency, it's about help. And you're saying that the Sheriff's Department really does want to be there as that representative.
Yes.
Okay, Dr. Nelson, there are two questions, you know, who are you going to be in all of this and what's the call to action?
Well, I try to be the person who will sit and listen to other points of view and try to see how they are right also, and to learn from that. And I want to encourage all of us to do the same. I want to say that, Laila, I don't even know if I'm saying your name right or not, and this sort of isn't a personal thing, but many of the adults in the communities that I work in have never invited me over for a barbecue, for dinner, or for, well, hopefully not for a dance because I wouldn't show up, but nobody would ever. But I can tell you that the kids I work with, they invite me into their hideouts when they're on the run from the police. They invite me over for dinner. They tell their parents, have this guy over for dinner. And that gives me a lot of hope for the future of our country at a time when there's not, you know, it doesn't seem like there's a lot of hope. And I just want to also say that, you know, I want to be the person who points out on a panel like this that we have someone saying, don't have her on again as a representation for people of color. That I don't think that that's the way that we should be viewing this. I'm assuming she's talking about the lieutenant, but all people can be a representation. She offers a point of view from a certain perspective, and there's not only one representation of people of color. I don't claim to be that person either, but part of the problem is when we start excluding people from our community discussions.
And Laila, you're going to get the final word before Tony Young. So who you want to be and what's the call to action?
I believe that organizationally, we want to be freedom fighters. But in order to do that, we know the work that needs to be done on the ground with public safety and accountability. And none of those things have anything to do with law enforcement. Accountability is accountability within your community. It's knowing your neighbors. It's knocking on doors. It's knowing the youth that are down the street and not being afraid to speak to them. That's the accountability that we're talking about. It's a love and an adherence to life. It's also making sure that our kids don't have to go to juvenile hall to get food. We argue if undocumented people can be fed, but they're quick to lock. There's no kid they're not going to lock up because they're undocumented, and give them as much food as they want and enough counseling, as much counseling as they need. And that stuff needs to be on the front end. It has nothing to do with law enforcement. We need to realign our budget. And that's what Pillars does. We fight policy. We like to take funding and put it elsewhere where it helps. The Board of Supervisors, we want to be a part of flipping the board and getting certain people out of there so we can put investments in the people that matter. Thank you.
Tony Young, you have the final 30 seconds.
Well, first of all, I love when after Laila says that, she says thank you. No one else says thank you. She's the only panelist we've ever had that said thank you at the end. But listen, you guys, one of the things, and I love Dr. Zachary Green and Carlos Nelson, but as a viewer to this, I would just say that it makes me feel so happy to see 3 women of color here on this panel. And the thing is that, you know, I can say that I am very happy that all of them are where they are right now, right? Because I definitely would want somebody like Tonya in the Sheriff's Department, right? I want that. And of course, I always smile when I see Laila because I just love seeing her, right? And I know what she does in the community. And then you have this brilliant woman, Dr. Roxanne Kymanni, who is able to articulate issues in a way that help all of us understand better, you know, and that to me is really special about this panel. And it just makes me happy that we have a community that we have that can articulate these issues and fight for the things that are important to us. So with that, I want to say thank you to all of you. We appreciate you. And Dr. Green, I appreciate your moderation, and also Roxanne. Dr. Kymanni, thank you so much. And just so you guys, as we leave, our upcoming programs, we have our nonprofit partnership trainings that'll happen on May 28th and 18th. One's going to be on leadership resilience, and the other one is on overcoming team dysfunction, which a lot of us have to work on. So with that, we appreciate you. God bless you, and you all have a very safe holiday weekend.
Thank you. Same to you.
Thank you, guys.
That was wonderful. Thank you.
Please answer your poll question, and Dr. Green, you can go over that.
Okay. Yeah, this is your feedback. Just take a moment before you close out to just give us the feedback, and that helps us improve our webinars going forward. Thank you so much, and good night, everybody.
Good night. Thank you.
Good night.
Thanks.